Good morning or good afternoon. I'm Mrs. Cruz and I will be your health science teacher this year. So I want to explain a little how the program works and how it works for distant students. Um, I'm going to do this one video to cover principles and health science theory. So because basically the way class works, it works the same for everyone. Syllabi are very similar and expectations are very similar. So, first of all, I hope all of you have utilized Google Classroom before. If you have not, please tell your proctor so that I can uh, post some videos that she can play for you guys to show you how to utilize Google Classroom effectively. So, what will happen is you'll have assignments on Google. All of your assignments will be on Google Classroom. I will make videos. Some of the videos will be done during my classes that I teach here at Cooper, and some of them will be an individual video. So first I'm going to tell you a little bit about me so you know why and how I'm able to teach this class. So I am a registered nurse. I've been a registered nurse for, probably close to 25 years now. I have a bachelor's degree in nursing. I also am a certified health science teacher. So I am both. I spent the first 10 years of my career working in ER, ICU, and med surg. When you're a nurse, a lot of times you work 3 12-hour shifts, and so you have other part-time jobs just to for additional income. And I did those first 10 years. I worked as an infusion nurse one day that on Monday, and on Friday I worked at a wound care clinic, and the next week I would work Monday on a wound care clinic and Friday at an infusion center. I learned so much those first 10 years I was a nurse working in multiple locations. And I enjoyed all of those things. I really did. Everything I've chosen to do in nursing, I've really loved, including teaching. Um, and then we moved to Cooper area, and I worked for a home health agency for 7 years. I really enjoyed that, and I worked as a field nurse, where I was a case manager for about 40 patients, and I worked with an LVN and sometimes two LVNs, and then I worked with a home health aide or two, and we were a team and we worked together. I did that for a couple of years, and then I moved into the administration part. So in the administration part, I was what you call a team leader. I was also the intake coordinator, and I did quality assurance. So what those jobs were as a case manager, you're responsible for making a plan of care for a patient, and then just working as a team with your LVN and your medical and your nurse aide to make sure that the care plan gets carried out. You confer with the doctor to make sure it's an appropriate care plan. Sometimes you refer them for physical therapy. You get them referred for physical therapy or occupational therapy, depending on what they need. Speech therapy. So you work with a lot of different areas in healthcare as a home health nurse. In ER, I worked pretty much side by side with a doctor and other nurses, paramedics, EMTs, the police department. I worked with them pretty close. When I worked ICU, I pretty much just worked a lot with the doctors and the other nurses that I worked with. As a med surg nurse, though, you work with physical therapy, occupational therapy, speech therapy, doctors, the lab, and in the ER and ICU, I worked with the lab closely because I drew my own labs, and then they would come in and help me process those. So you do a lot of different. There's a lot of communication between multiple areas in healthcare, no matter what you do. When I left the home health agency, I'm sorry, I was turning my phone on silent. When I left the home health agency, I went to work in Sulphur Springs, and I was the nurse manager for all of their clinics, for multi-specialty clinics. So in those clinics, we had orthopedics, we had family practice, we had pediatrics, we had ear, nose, and throat, we had OBGYNs, we had urologists, we worked with the gastroenterologist that came in. Trying to think, is that all my clinics? And then we had a clinic in Emory that I supervised their staff as well. So I did some infusion therapy while I was in there, just kind of, and managed about 53 staff members. I had to do disciplinary actions. I had to do growth plans for staff, education for staff, and I managed LVNs. I managed medical assistants. I managed X-ray techs, pharmacy technicians in that position. I also worked side by side with the lab to ensure that our in-house lab was running smoothly. So I've actually worked with lots of different in lots of different areas, which helps me be able to give you guys good information on what the expectations are in the real world for someone as a healthcare professional. I know what doctors expected from me. I know what doctors expected from their staff. I know how important it is to work side by side with other healthcare professionals to ensure that what the patient gets is the best outcome. We want our patients to do well. I've worked with hospice agencies. I didn't talk about that, but I've worked hand in hand with hospice agencies to get patients better care. I've helped patients go to rehab for post-operative care, as well as provided swing bed care, which is post-operative care for rehab. And I have worked with social workers, and also I have worked with nursing homes to get patients placed when we needed to, with child protective services, with adult protective services. So once again, I've worked with lots of different kinds of healthcare professionals. Psychiatrists, I didn't talk about that. We had a psychiatry clinic. I worked with a psychiatrist. I worked with psychiatrists. I've worked with psychologists and with therapists. So I've worked with lots of different types of people in my career. Hopefully that gives me a broad enough view to help you do what it is, choose and be successful in whatever healthcare career you're going on. If you don't know what healthcare career you want to go on, maybe I can help you figure out if that's really what you want to do. How things start in school is we start with a principles class. Some of you already had principles. And in principles, we just really look at the big, broad view of healthcare careers. We learn about anatomy. If you're taking principles, we will do a lot of medical terminology because you'll also get articulated credit, which means if you make an 80 or better, you can choose to get college. You'll get an articulated credit, which means when you go to college, you would get credit. You would take your transcript, and after you've completed 6 hours there, they can give you credit for medical terminology 1. So if medical terminology is required in the career you go into, then you will have that credit completed. If you're taking health science theory, you get credit for basic health professional skills, and if you make an 80 or better. This isn't something that you have to pay for. Just because I have partnered with Advanced Technical Credit, we can offer that credit to you, so it's not an extra charge. It's not like going to pay for classes at PJC. It works a little bit different. So if you have questions about that, or your parents have questions about that, please have them email me. On your syllabus, it will have my email address, it will have my office number, and it'll also have my conference hours. So if your parents need to call me, they can call me during that time. Also, I do my very best to make myself available to students as much as I can. So the easiest way to contact me is either to message me or to email me. Email my school email address, which is on your syllabus. It's my first name dot last name at cooperbulldogs.net. So it's jana.cruz at cooperbulldogs.net. You can message me on Google Classroom. You can do private messaging on Google Classroom where it doesn't show up on the classroom stream, and I will get back to you. It does come to my email when you do that. I do check my email between classes. I just have 2 or 3 minutes between classes. And then I do check it during my conference period. I check it before school. I check it after school. And I usually will answer messages till about 8 or 9 o'clock at night. And then about 9 o'clock I stop answering until the next morning. So about 3 years ago, back to kind of how I got here, about 3 years ago, a young lady that I used to work with was going to leave the position that I'm in now, and she called and asked me if I would be interested and wanted me to come and sit with the class for a day or two and just kind of observe what she did. I did that, and I thought, you know what? This is a really, really, really neat environment, really kind of cool thing that we can do. At that time, we didn't offer anything but you could go through PJC and get a CNA certification, or you could um, go through the pharmacy tech program. And it was a hybrid pharmacy tech program with Pass Assured and with her doing some supplemental education. In the last few, I've been here 3 years, and the first year we didn't really add a lot to what we were doing. I was learning just like everybody else what needed to be, what we kind of needed to do. And I'll tell you, I learn every day. I learn from teaching, I learn from my students, and I appreciate learning every day. That's one of the things as a healthcare professional you have to love is you have to love to learn because things change so fast and new things come that are better than what you did before. And so you have to learn, be prepared to learn those new processes and new things. So last year we started offering clinical medical assistant certification along with pharmacy tech certification. We can also offer phlebotomy. Sometimes distance, I have to work with your school because with distance, with phlebotomy, you do have to get 50 live sticks. In our school, um, we do not let students stick each other. Now, it's possible for your family or teachers or someone to volunteer to let you get your live sticks in. We can do EKG tech. And so with those also you have to have some access to EKG machine or to learn lead placement and what it looks like when the EKG comes out and kind of how to interpret that, those kind of things. Whether it goes directly to the doctor because it's an emergency or kind of have to learn about what those rhythms are. So those are things that we can teach. I will tell you one of the cool things we were able to get last year at Cooper. We got a sizable grant, and some of you will be coming over to see me this year, and I'm so excited about that. If you're taking theory class, most of you I think will come over and see me this year. Probably once every about 6 weeks or so, you'll come and we'll do some hands-on. But I was very fortunate to get a grant so that we have a separate classroom besides the classroom you're seeing me sit in now. And I have a hospital room and a mock doctor's office room. And in my mock hospital room, we'll have an IV pump. We'll be able to start IVs on the mannequin. We can give injections to the mannequin. We have IV arms where we can practice starting IVs as well as doing venipuncture to collect blood. We'll learn how to process blood. It's not in yet. Hopefully it will be in this week, but I have ordered a phlebotomy chair. We have a centrifuge and we have a little mini fridge so that we can practice getting those specimens ready to go to a reference lab. If you're taking medical assistant class, we will learn about reference lab. I do teach students in medical assisting to start IVs. In principles, we'll do vital signs. We'll learn first aid and CPR. If you're a medical assistant student or a pharmacy technician student, any one of those kind of students that's getting a certification, you get BLS certified, which is basic life support. But for my principal students, we do first aid and CPR. You do learn to do vital signs. We learn to do some basic assessment skills. You learn about anatomy and principles. We do some projects in anatomy that are pretty fun. We learn about insurance. We learn about different healthcare systems and how they work. We do review that also in medical assistant class and with my certification programs, but it's on a higher level. You learn about coding and how some types of billing work, things like that. We learn about medications. We learn about administering medications in my certification classes. Both classes we learn medical math. Sometimes that can be challenging, but we do learn about medical math in both classes. Pharmacy tech, it's really heavy. Medical assistant, you do learn it and you get a good grasp of it, and we kind of do the introduction to it in principles. Other things we do that we are going to be able to do for my certification students, we'll have an autoclave so that we can practice asepsis and cleaning instruments appropriately. We have a cardiac monitor and an EKG machine. that can be used in the patient room, or it can be used in the doctor's office room. So you'll learn EKG placement and how to run the EKG machine, how to clean it. We have vital sign, electronic vital sign machine, as well as manual vital sign machines, or manual blood pressure cuffs and thermometers and all those kind of things. If you're in a principal's class, you're going to learn to do it manually first. So you're going to learn to use a manual blood pressure cuff, how to take a regular temperature under the tongue, how to count respirations, what O2 sat looks like. You'll learn kind of what those normal values are. In my principal's class, in that little lab, and we'll learn some about basic labs. In my certification labs, we go more in depth on labs. You learn how to not only how to collect them, but what the critical value and what a normal value range are. We will have opportunities to do assessments on practice head to toe assessment, and take medical history, how to collect medication lists, and how to know if those medications should be given together or not. We'll learn some basic pharmacology and principles. If you're a pharmacy technician, you learn the top 300 meds that are prescribed in the state. If you're happen to be doing pharmacy technician, you also will learn things like compounding and mixing medications. We'll learn, even though as a medical assistant you may not ever start an IV, we do learn about IV therapy. So we really learn and cover tons of things. Medical assistants, we do learn about anatomy quite a bit, because there's quite a bit of anatomy on that exam. If you have an opportunity to take anatomy before you take your certification exam, I would recommend that. If you've already taken anatomy, wonderful. It's going to help you so much. The medical assistant certification exam is heavy, has quite a bit of anatomy. We're going to learn about different kinds of procedures in all classes. We'll actually learn how to set up for those procedures. In medical assistant class and principals, we'll learn about sterile field, and you guys will actually see what it's like to set up a sterile field. There'll be times that I have some certain classes help teach other classes, or you may go down and teach a lower level class in your area, something about healthcare. Education is a huge part of what we do every day in nursing and in healthcare. No matter what you're doing, you're educating your client or your patient. So, you're educating them on diet, you're educating them on their medications, you're educating them on wound care, you're educating family. So we'll learn about educating. We'll also learn a lot about professionalism. Professionalism is very important, and I want my principal students to get a good grasp on professional behavior, professional communication, whether that's written communication, verbal communication, or digital communication. Realistically, there's a lot of things that go on in the digital world, and in the healthcare setting, we have social media that we'll talk about the do's and don'ts of social media. I'll talk to you about why we have chosen not to hire very well-rounded candidates due to their social media. So I'll talk to you guys about the professionalism related to those things. We'll learn about resumes, interview process. I'll talk to you about why I chose not to hire different people I've interviewed over the years. We'll talk about cover letters. We'll talk about filling out an application, how to answer the phone appropriately, how to take a good message. Those are all things that are important in the healthcare world that we have to be sure that we're doing. So those are kind of some of the things we'll cover. So other things I want to tell you guys is that tomorrow there will be a video on how to take notes. Sometimes it's really difficult to take notes when you're listening to a lecture and you have slides and you think, oh, I need all this information. We'll have a video tomorrow on kind of how the best ways to take notes are. I want to take a few minutes to talk about syllabus. You have two different syllabi. The first syllabus is a general course overview, and that's one that you need to get signed by your parents, bring back to your teacher in a week, and if you do that within a week, then you will be able to get a free 100 test grade. I mean, that's all you do is have to turn it in on time. So as long as you turn it in on time, you get 100. Easy cheesy. Your other syllabus will be a daily syllabus, and that will kind of help guide you where we're going. I tend to cover a lot of material the first semester, and we slow down a little bit the second semester because, unless you're in a certification class, if you're in a certification class, we don't slow down at all. We have tons of things to cover, and you're going to take that certification exam. Hopefully, within the first few weeks, you will take it in the month of May. So we have to get everything done, and you have to have time to do practice exams before May gets here. So certification classes, they're busy, busy all year long. For my principal's classes, we work harder in the fall, and in the spring we do slow down just a little bit because it gives us time for all of those things we're gone for. Lots of times students are gone for sports in the spring a lot. There's FFA activities, there's beta, there's a National Honor Society things, there's band things in the fall and in the spring, both I know. Basketball picks up in the spring after Christmas. So we really, and plus we have a little more holiday kind of stuff going on. So there's just a lot of stuff that goes on in the spring. It took me a year or so to learn how busy the spring semester is in most schools. So we do hustle in the first semester. That doesn't mean we slow down a ton. That doesn't mean, but we do have a little more flexibility. Other things I really want to talk to you guys about is I want you to be sure that I may not be there with you every day, but if you don't understand something, please let me know. Email me. You can call my classroom. You can message me on Google Classroom. But please, please, be sure if you don't understand something, you let me know. I can make another video. If it didn't come through clear, if you let me know, I can make another video. Most of you are not going to have someone who really understands what we're teaching as your proctor, so let me help you. When we get to medical math, if you just don't get it, there are other ways for me to show you how to do it, which means I may pull a video from someone else who teaches it a different way that may make it you understand. I may do some specific problems you don't understand. That way, when we do those, you have a better grasp. Like maybe you just don't understand one kind of problem. Now, when you don't understand something, don't tell me I don't understand what we did yesterday. Well, we may have done a lot of things yesterday. Tell me specifically what you don't understand. Like, I don't understand why red blood cells do what they do. Okay, I can help you with that. But when you give me this huge, broad, I don't understand what we did yesterday, I may have talked about 10 things yesterday. And just be specific for me so that I can help you with what you really don't understand. If we're doing a resume and you don't understand how to do the objective, say, Miss Cruz, I don't understand how to do the objective. Can you help me with an objective? Those are specific things that I can help you with. The other thing is, however we ask you to turn things in. If you're asked to turn it in on Google Classroom, please turn it in on Google Classroom. If you share it with me, because some schools have students just share stuff with them as opposed to turning it on Google Classroom, it's hard to find it. Remember that I teach, and I'll tell you, I teach 7 class periods here in Cooper, and then I teach 4 other schools distance. That ends up being around 300-ish students, between 250 and 300 students. So if everybody shared something with me, I really might have a hard time finding it. But when you turn it in on Google Classroom, it puts it where I can just click on and find it. I will show you how to unsubmit something. Maybe I need you to go ahead and turn it in so I can look at it. And then I'll tell you, okay, unsubmit that and fix these things and then submit it when it's done, when you fixed it. You will write in this class. You'll have bell ringers sometimes. You'll read a book and we'll do some work related to that book that you're going to read over the semester. It'll be closer to Christmas, but you guys will have a reading project. You'll have so many pages to read every day. Pretty much if I give you something to read, I'm going to give you a quiz over it the next day. If I give you the weekend to read it, you'll have a quiz on Monday. Because I expect you to do the work. Are the classes hard? Not if you do the work. If you wait till the last minute to study or you wait till the last minute to try to complete something that I've given you, several days to do, then yeah, it might be difficult. Um, but if you just stay on task, everything will have a due date. It'll have a scheduled date and a due date. Usually I make things due by the end of the day. I don't make them due necessarily during your class period unless it's a test or a, um, a test or a quiz. Most of your quizzes will be given on Google Classroom. But that will strictly be up to your in-class proctor. Some may choose to give it to you on paper. If your in-class proctor chooses or your school chooses to do those on paper, they'll do them on paper. But some of you will do them on Google Classroom. I will tell you, I do not tolerate cheating. Academic dishonesty is dishonesty. And in the world of healthcare, you cannot be dishonest. You must be honest even when you're failing. Even when you make a mistake, you have to be honest and upfront about that. Because if you don't, you have people's lives in your hands. And so I do not tolerate academic dishonesty. That includes plagiarism. If you cut and paste and don't cite sources, if you use someone else's work, if you cheat at all, you get a 0. I do not tolerate that. I give you 5 days to turn something in. So if it's due on Monday and you don't turn it in Monday, but you turn it in Tuesday, the maximum grade you can get is a 90. If it's Wednesday, the maximum grade you can get is an 80. If it's Thursday, the maximum grade you can get is 70. If it is Friday, up until Friday, if it's due on Monday, on Friday, the maximum grade you can get is a 50. That means if everything is correct, the maximum grade you can get. After a 50, after 5 days of something being late, I don't accept it. Now, if you're absent, please let me know you're absent. Shoot me an email and say, Miss Cruz, I wasn't there yesterday. Send me a message that says, Miss Cruz, I wasn't there yesterday. I was absent yesterday. Or I was on a field trip with another class. Or I had to leave early and we were gone for a basketball tournament or a softball tournament. If you let me know that, then I understand that you couldn't have turned it in. You were gone. Or you didn't get to work on it on something that you needed to work on in class. If you don't have internet access at home, I understand that also. Just let me know. I tend to be as understanding and respectful to you as you are to me. Things happen in my life too that sometimes I'm not here, and I have to be gone. And so we may have instead of getting a lecture, you may have an alternative assignment or something. Or I may give you an extra catch-up day. Sometimes things happen and we get behind. Sometimes you guys have assemblies or you have things that I don't know about. If I don't know about them, I can't make adjustments for that. But if you let me know, I can make adjustments. So just the biggest thing we need to do between you and I is to communicate. Just because I'm not there doesn't mean you can't ask me questions. You'll see when you see where I record during class, you're going to see how many questions students ask me. You're going to kind of see how the classes work here in my home school. When you come over, and some of you will get to come over and do clinicals or do hands-on stuff here at school. When you get to do that, you're going to see that we do have fun. This should be an enjoyable class because there's so many things that you're learning that are new. And you do get to do projects, and you do get to do hands-on things. And you get to work in groups, and you get to have some fun activities to do. So, that's kind of a little bit about tests, a little bit about your syllabus, those kind of things. Now, some of you will go ahead and have your first assignment. Some of them it will be tomorrow. So let me let you guys get started on. I think this has been about 30 minutes. So by the time you get in and get things logged in and get logged out and those kind of things, it tends to be about 35 minutes is about the most a lecture for a one class period will be. There'll be some things I ask you to do just so I know a little bit about you. Some of you may have already completed the student survey and a little kind of what do you know. I'm going to put that up so that I can actually see what you know on my end. It's not for a grade. Completing them gives you participation credit, but do the best you can because it'll tell me what you guys have learned so far. I don't want to teach you something you already know, or if you already know, you might could help someone else learn it. So just please do those couple of things for me today. And if you're in one of my CERT classes, you're going to go ahead and have a reading assignment. So kind of get that started for me if you can, and we'll pick that up tomorrow. You guys have a wonderful day, and I'll be back with you soon. Thank you.